Good morning. We will be talking today about active surveillance in patients with prostate cancer. Active surveillance has been touted as one of the modalities of management of patients with early stage prostate cancer who have a favorable prognosis. These patients are now subsequent to the USPSTF task force recommendations, been increasingly been found in urological practice. However, let us step back a little bit and try to understand what active surveillance entails. Active surveillance is recommended for patients who have a long life expectancy, who are otherwise healthy, but who have been diagnosed with prostate cancer, which in itself has been considered to be not lethal. These patients are put on an active monitoring protocol, which is active, as you can understand, in which case you will get a repeat PSA every 3 to 6 months. You will get a digital rectal examination with the urologist at the same time. If your PSA does go up, you may require additional imaging studies and definitely a follow-up biopsy within 6 to 12 months and subsequently every 2 to 4 years. So it's a pretty complex follow-up routine in patients with active surveillance. Active surveillance doesn't mean that you've got cancer, you don't need not worry and just forget about it. That's not the case. So the patients, what can they expect is what are the advantages? Why was active surveillance included in the entire protocol for prostate cancer? One, we wanted to avoid over-treatment and its subsequent and consequent side effects of urinary incontinence and sexual dysfunction. Two, they thought that a lot of these patients would never progress to a metastatic disease, and so treating them at an early stage was actually disservice, as there were higher chances of complications as well as morbidities. And number three, that patients would preserve a better quality of life. Now, that being said, what are the downsides of active surveillance is something that is not often recognized, and a lot of patients walk into the office saying that they've been on active surveillance and they've been doing fine, but then you find that they were actually at the first place, at the outset, not candidates for active surveillance. Anyone who's got a Gleason 7 or higher prostate cancer, who's got high volume disease, is definitely not a candidate for active surveillance. The other downside is that, according to the data from the National Cancer Institute, almost 70% of patients who have been on active surveillance will require some form of treatment, be it radiation, be it a radical prostatectomy in the hands of an experienced surgeon. Active surveillance does not mean that you will not require treatment. You're basically moving the goalpost away. And over time, if you live long enough, there would be a point at which you may require some form of intervention. In addition to that, the anxiety associated with routine monitoring can be quite detrimental to the patient's overall psyche, and which has led to the coinage of the term, instead of active surveillance, call it anxious surveillance. In addition to that, the more biopsies that you get, there has been a seminal paper a few years ago which has stated that patients who have been on active surveillance and who have undergone 2, 4, or 5 biopsies, and eventually they would go ahead and get surgery, the outcomes in terms of preservation of neuronal function is far inferior to that if they had a surgical intervention at the outset. Active surveillance definitely is a form of treatment that can be chosen in very early stage prostate cancer, but with the caveat that it can, over time, cause a progression of the disease, may even lead to metastases, and at the same time, the disease at a later stage in your life may not be so amenable to a definitive form of treatment than when you are at an earlier stage and younger in age. So it's important that we do talk about side effects as one of the factors which has led to adoption of active surveillance in clinical practice. But choosing an experienced robotic surgeon will definitely go a long way in mitigating the possible adverse outcomes that have been reported for radical prostatectomy. Thank you.